Hello brainers, my name is Chase and welcome to the Big Brain Busters. So in this video I'm going to take you through anatomical terminologies, position and movements. So now let's look at some of the approaches of studying anatomy. As you know that anatomy is simply the study of the structure of the human body. So there are three main approaches on how you can study anatomy, and these are regional anatomy, systemic anatomy and clinical anatomy. So let's start with regional anatomy. Regional anatomy is also known as topographical anatomy, and this is simply the study of the human body as major parts or segments. So you study the body according to the parts or segments. So as you can see here, we have these parts such as the head and the neck. Then you have the main body. This is the main body here. This main body has got divisions such as the thorax, the abdomen, the pelvis, and the back. Then you have the two paired limbs, the upper limbs and the lower limbs. So that is how you study regional anatomy. So those are the divisions, and these are the division of the main body. Let's proceed. So now these are the main parts or segments that we study or focus regional anatomy into. So as you can see, we have the upper limbs and the lower limbs, the thorax where the diaphragm ends, that is where the thorax ends, and then that is where also the abdomen begins. Then we have also the pelvis and the perineum which houses most of the reproductive and the reproductive and the digestive, such as the anus. These are the organs that are housed in the perineum. Then you have the head and the neck. Okay. Then now, the next division is simply systemic anatomy. So systemic anatomy is the study of the body's organ systems that work together to carry out complex body functions. So you look at the structure of the body according to their systems, such as the integumentary system for the skin, the skeletal system, muscular, central and peripheral nervous system, the cardiovascular system, the respiratory, digestive, endocrine, reproductive, urinary, and lymphatic system. So this is you study these systems according to systemic anatomy. Okay, so as you can see, this is just some of the systems that I've put about. This is the skeletal system there and the muscular system that are responsible for your movement and balance. Then you have the the bone and muscle tissue. So this is now under histology, the histological part, and the integumentary system. Okay. Then now let's look at clinical anatomy. When you look at clinical anatomy, it's simply the study of the clinical aspects of regional and systemic anatomy. So in this case, you study the structure of the body of the human body. Then under clinical anatomy, you now get to mix the two, both regional anatomy and systemic anatomy, and then you get to apply it clinically. So this is the clinical application of regional and systemic anatomy. For example, this is regional or systemic anatomy. These two approaches of anatomy will actually show you to say the upper limb is made up of what? Is made up of these bones. It's made up of the scapula, it's made up of the shoulder joint, it's made up of the clavicle, it's made up of the humerus, it's made up of the elbow joint, it's made up of the radius and the ulna, and then it is made up of the bones in the hand, like that. Then now when you apply that knowledge clinically, you find that under clinical anatomy now you study what can go wrong here. So that would be that, like for example, here there is a fracture on the humerus. So this humerus here, there is a fracture. So that you study it under what? Under clinical anatomy. Another example that I can give is this. So under regional or systemic anatomy, it will show you that there is actually a nerve known as the long thoracic nerve. And this long thoracic nerve, it innervates the serratus anterior muscle. So now what under clinical anatomy, they'll tell you that lesion or perhaps any damage to this long thoracic nerve will cause a condition known as winged scapula. So this is a normal scapula and this is a winged scapula, in that order. Okay, so now let's take a look at some of the anatomical terminologies. So as a medical practitioner or as an anatomist, you need to be familiar with the anatomical terminologies, because that is the standardized way on how medical or perhaps health practitioners actually communicate. So For example, there are some layman's languages that we actually use in our daily lives, which are colloquial terms. So these colloquial terms in medical language, actually, they are not allowed, perhaps. So in medical language, there are standardized terms that are used in order to communicate with fellow medical practitioners, such that when you go to other regions of the world, such as the other countries, you find that when you use the same anatomical terminologies to another, when you use those terminologies to another health practitioner, they'll be able to understand actually what you are able to communicate. So that is what anatomical terminologies are all about. So now let's take a look at a few. For example, when you look at the armpit, that is a colloquial term, or that is a layman's language. But then in medical language, you actually call it the axillary fossa or the axilla. A fossa is simply a shallow depression. So that is why we refer to this region, the armpit, as the axillary fossa. So the most important part, as I have mentioned, to say medical terminologies are used to communicate with fellow medical practitioners, but then you must also have that knowledge of what? That knowledge of colloquial terms, because those are the terms that you are going to be using to communicate with your patients. Yeah. So for example, let's say a patient comes to you and then says they are having a pain in the stomach. So a pain in the stomach can, signify a certain defect, but then they'll tell you to say they're having a pain in the stomach. The stomach is actually an organ, so meaning that you as a medical practitioner, you won't actually call it the stomach, you actually call it the abdomen. So in the abdominal region, that's where the pain is. And then when you run some tests, you might find that it's actually appendicitis. So that is why you need to be able to know the colloquial terms and the what? And the medical terms. Okay. So another example I can give you is the funny bone. So the funny bone here, in a colloquial term, is actually not really a bone. It is actually the ulnar nerve. So there is the ulnar nerve passing through on the medial side of the of your upper limb. It is passing on the medial side, passing through the medial epicondyle. So there is an epicondyle here on the articulation of the humerus and these two bones here. So there is a medial epicondyle. So that along that medial epicondyle, there is an ulnar nerve that is passing there. So when you hit or bump this part of your this part of your upper limb on maybe anything, you find that there is that funny sensation that you feel, and that is why in colloquial terms they call it the funny bone. But you as a medical practitioner, you must know that it's actually the ulnar nerve. Okay, then another term that you can also refer to is another term that another colloquial term that is common is the you have the collarbone. So the collarbone is, in medical terms, you actually call it the what? The clavicle. Okay. Then you have also the shoulder blade. The shoulder blade, that is a colloquial term. Then in medical terms, it is actually known as the scapula. So in those kinds of terms, you must be able to differentiate colloquial terms from medical terms, but you must know both for efficient communication. Okay, let's now look at the anatomical positioning. So whenever you are talking about anatomical positioning, there is a standardized way in which you must describe body parts, where that you must describe body parts in a certain position, and that is known as the anatomical position. And that anatomical position are these two diagrams that I've shown here. So a person must be standing upright, and then the head is facing forward. These upper limbs with the hands, the upper limbs are actually hanging down like that, and then the palms are actually facing forward as well in that manner. So this is known as the anatomical position. So if someone tells you to stand in anatomical position, this is the standardized way of standing in an anatomical position. Now there are other positions that we are going to look at. These are some of the positions again. Um, so in a prone position, when a patient is lying in a prone position is when the face is actually facing down in this manner. Then in a supine position, so when I say lie in supine position, your face is actually facing upwards like this. Then when I say you lie in a right lateral recumbent position, this is the position, okay? Then this is Fowler's position, more like as though you are seated while while you are resting your back on something. So this is Fowler's position, and then you have the lateral recumbent position, and then you have the Trendelenburg position. So I usually have problems with pronouncing this word, but anyways, yeah. So in that manner, these are anatomical position, but the main standardized way of sitting in anatomical position is standing in anatomical position is the previous picture that I've actually shown you. Okay, so now let's look at the anatomical planes. So these anatomical planes are simply imaginary lines that are sectioned on your body when you're standing in anatomical position to describe certain positions of your body parts. So you have the median planes, as you can see from this diagram. You have the main median plane that cuts your body into right and left. Okay, it cuts your body into half. Then you have the sagittal plane that is actually not in the middle, it's not in the median. So the other name for the median plane is median sagittal plane. Then you have a sagittal plane that is not in the middle. Okay, then you have a median plane of the hand, and then you have the median plane of the foot. The median plane of the hand, it cuts the hand into right and left in equal. Then the median plane of the foot cuts the foot into right and left as well in that equal manner. Then a line that is just parallel to the median plane is known as the parasagittal median plane. Okay. Then another example of an anatomical plane is the frontal or coronal plane. It is the one that cuts your body into anterior and posterior, or it cuts your body into front and back. Okay, in that manner. Then another one is known as the transverse or axial plane. The transverse plane sections your body into in a horizontal manner. Okay, so as you can see from there, so this is a transverse or axial plane. Then you have a frontal or coronal plane just like this one. Now it is for the feet. It sections your feet in that manner into anterior and posterior. Okay, then the transverse axial plane cuts your body into superior and inferior. All right, then now let's look at these planes into parts. Okay, so there are parts. Now let's say if you focus these planes into just the parts such as the lower limb, you have a longitudinal plane or longitudinal section, as you can see here. So this is a longitudinal section cutting your entire lower limb into half. Then you have a transverse section where you section your your brachium. This is the brachium or the arm into horizontal section. Then you have an oblique section. An oblique section is one that is not sectioned in a longitudinal manner or transverse manner, but it is sectioned in an oblique manner or diagonal manner. So this is one of the manners or planes. Okay, so now let's look at the terms of relationship and comparison. So let's look at these first two terms, such as superior or cranial and inferior or caudal. Cranial means head, towards the head, then caudal means towards the tail. So when you talk of anything superior, a body part being superior, meaning that it is towards the head. So for example, let me use the umbilicus and the nipples. So we can say that the umbilicus is inferior to the nipples, and the nipples are superior to the umbilicus. So in that manner, so that is how you use the inferior and superior term. So you use it according to a point of reference. So if your point of reference is the nipple, so meaning that the umbilicus is the one you are referring to, so you say the umbilicus is inferior to the nipple, or the nipple is superior to the umbilicus. In that manner, you can also use another point of reference such as the ankle joint and the knee joint. You can say that the ankle joint is inferior to the knee joint and the knee joint is superior to the ankle joint, in that manner. All right, Then let's look at the other two terms such as anterior and posterior. Anterior, you are actually referring to body parts that are in front, okay, anterior in front, then posterior at the back. So when a body part is in front of another body part, you say it is anterior to that body part. Then when it is behind another body part, you say it is posterior. Okay, so you can say an example that I can actually give. You can actually say that the penis is anterior to the buttocks. Okay, but you don't actually say the buttocks because in this case, it's actually the buttocks actually made up of gluteus muscles. So you can say the penis is anterior to the gluteus muscles in that manner. Okay, so yeah. Then let's look at other terms such as medial and lateral. So medial means towards the middle, so meaning that whenever a body part is towards the midline, this is the midline here. So when the body part is towards the midline, you call it medial. Then when it is away from the median, you say away from the midline, you say it is lateral. Okay, in that manner. So for example, you can say the left eye is lateral to the nose, or the right eye is lateral to the nose, or the nose is medial to the eyes, in that manner. Okay, so you always have a point of reference. Then let's look at other terms such as these that I've displayed. So we have palmar and dorsal. So these two, palmar and dorsal, these are actually specifically for the limb, for the hands and the legs. So for palmar, it refers to the palm. Okay, then for dorsum, it actually refers to behind the palm. Okay, the back of the palm is known as the dorsum. Okay, same as for the legs, you refer to the dorsal surface to be on top here, the legs. Then the plantar surface here, in this case, the plantar surface is simply this surface, just where you step your foot on. Okay, then it is actually known as the what? The sole. So those are the anatomical uh, terms that you use. Okay, then let's also look at the other terms such as superficial. So superficial means nearer to the surface. So when I say this bone is deep, so there's a term called deep and superficial and intermediate. So superficial means towards the surface. So we can say that the muscles are superficial to the bone. As you can see, this is a section of the arm. So the muscles are superficial to the bone. So this is an example I've given here. Then there is intermediate. Intermediate meaning that it is between superficial and deep. Okay, so meaning that when a part of a body is between a part which is superficial and another part which is deep, so meaning that that body part that you're referring to is intermediate because it is in between a superficial body part and a deep body part. An example, the biceps muscle is intermediate between the skin and the humerus. So you have the humerus there and the skin. So meaning that the muscle that is in between here is intermediate. Okay, then when you talk of deep, deep meaning that it is further from the surface. Okay, an example is the humerus is deep to the arm muscles. So as you can see, the muscles are towards the surface here, then the humerus, which is the bone, is towards the center. So you call that what? Deep. Okay, so now let's look at the terms of movement. So when you talk of the terms of movement, in short, how do you move your body? Like when you move your body, what do you refer to? Again, another thing, always have a point of reference. So there are these two terms that we call flexion and extension. So when you flex your hands or you flex your limbs, okay, flexion is simply a term of movement that is referred to when you reduce the angle. When you reduce the angle at a reference point. An example, let's say your reference point is your shoulder here, this shoulder joint here. This is your reference point. If your hand is in this direction, so you are considering this angle here. So when you flex your hand, this angle here, you find that it is actually reduced to this. So this is known as flexion. Okay, this is known as flexion because you have reduced or decreased this angle here. Okay, then extension, meaning that you are increasing the angle between two body parts, and those angles, or be between two body parts or between two bones. Okay, so that is known as extension. So an example is this: when you push your hand to behind, you find that this angle actually grows. Okay, it actually grows. So this is known as extension. But when you bring your hand, towards the front like this, you are reducing this part. So this is known as flexion, because you're reducing the angle. Another example is this part here, the hip joint. So in the hip joint here, you find that this angle, if your leg is just straight like this, you find that this angle is almost, let me say, 90. Then if you move your leg towards the front, you find that this angle is reduced. So this is known as flexion. But when you move your leg towards behind, you find that this angle grows. So this is known as what? This is known as extension in that manner. Then this was our reference point here was the shoulder joint and the hip joint. So now let's look at the elbow joint. So the elbow joint, then I'll draw another line here, the elbow joint. So you find that your hand is straight like this, so you find that the angle is like 90. Then if you flex your hand like that, you find that your angle will be reduced like this, maybe it will be 30. So this is known as flexion. But when you push it back like this, it can't be pushed this side. When referring to the elbow joint, you can't push your hand this side, because that's impossible, because the elbow joint only is able to move it in this direction, in a 90-degree, in a wide, in this 90-degree angle like this, or 180 degrees. So this is the kind of movement that your elbow joint is actually able to do. Okay, so in this manner, you find that this is flexion. Then when you take it back straight, this will be what? Extension. Okay, then let's look at another example, such as this one. So this is flexion at your hip joint. You find that at your hip joint here, when you're standing straight, and sorry, but let me just rub this line. Okay, so you find that at the hip joint here, when you're standing straight, this angle here is like a 90, but then if you move your head forward like this, you find that you are actually reducing this angle. But when you take it at the back like this, you find that you are increasing this angle. So this is flexion and this is extension. Okay, then same as this part here, in reference to your ankle joint, you find that if you move your leg so that you have a dorsiflexion because you are reducing this angle here. Okay, you're reducing this angle on your leg here, right? So towards the dorsal, remember that this top part of your leg is known as dorsal, so this is dorsiflexion. Then when you move it down like this, you are increasing this angle here, so meaning this is known as plantar flexion. Okay, then more terms. So you have supine and prone. So when you supinate your hand, you are actually, turning your hand so that the palm can face, upwards. So that is known as supination. Then when you face your palm towards the ground, that is known as pronation. So when you are turning your hand to face so that the palm can face downwards or upwards, those movements are supination and pronation. Then you have two terms again known as adduction and abduction. So in reference to this midline, the median plane of the hand, you find that if you move your fingers away from this midline, that would be abduction, because abducting is moving away, adduction is taking it back. So abduction is moving your fingers away from this midline, then adduction is taking it back towards this midline. Then when you say lateral abduction, so it depends if you're taking it, towards your, if let's say for example this is your body here. Okay, if this is your body, you find that this is the medial part. Okay, this is the medial part because your body is like aligned this side. So if you move any part of your fingers towards this part, this will be medial. This will be what? This will be medial and abduction. Then if you are taking it away from the midline, that will be lateral abduction. All right. Okay, so continuing with the same terms, abduction and adduction. So if in reference to the midline of the body, the median plane of the body, you can move your hand away from the median part of the body, so that will be known as abduction, because you're abducting your hand. You're taking it away from the median plane. Then when you are taking it back, that will be known as adduction, and same applies to your lower limbs, like that. Then there is another term of movement known as circumduction. Circumduction is simply a rotative kind of movement where you are rotating either your hand or your lower limbs. So circumduction involves four main movements. It involves flexion, because you flex your hand first. Then after flexion, then you abduct your hand. Then after you abduct your hand, you will extend your hand. Then after you extend your hand, you adduct your hand. So these are the four main movements that are involved in circumduction, right? Then you have retrusion and protrusion. When you protrude your lower jaw like that, you move your lower jaw, you move it outwards like this. So this is known as protrusion. You protrude it. Then retrusion is moving it back into position. So this movement is actually carried out by the one and only joint, which is the TMJ, the temporomandibular joint. It is the only movable joint of your skull. Okay. Alright, so that is the end of our video. Hope you liked it, and hope you share, subscribe, and comment down in the comment sections. I hope you enjoyed the video. This is the end. Shalom, shalom. Thank you.